Very good afternoon. Myself, Dr. Ekta Khandelwal, Additional Professor, Department of Physiology. I'm the Nodal Officer for NMCN activity, and today I'm going to talk about vascular functions in health and disease, which is very important for you also to understand how you can apply this knowledge in biomedical. Right? So let's begin. Cardiovascular system. Cardiovascular system consists of two main components, cardiac and vascular. Cardiac is something which is basically associated with heart, right? And vascular component, all the vessels in the body. It is the cardiac component which is basically assessed in thorough, right? अगर अभी आप ध्यान देंगे, either it is sudden cardiac death or something, everybody is focusing on what is happening to heart in spite of what is happening to your vascular system. So, the main thing is this, assessment of structure and function of heart is very much known, but assessment of structure and function of vessels, blood vessels is not very clear. So today I am going to talk about how the functions of our vessels can assist us. If you understand the basic design of cardiovascular system, it is the higher center which is the boss and which modulate your both parasympathetic and sympathetic control. Right? This sympathetic control has direct effect on blood vessels as well as heart. And together they give their information to baroreceptor to control their all the activities, how your blood pressure and heart rate responds, right? So it is basically the healthy state of your physiological body which affects your heart center, higher centers as well as other signals, which is basically emotional based. So they modulate and regulate your heart pressure, heart and blood pressure. So the question arises, why you want to quantify the signal, right? First of all, you have to know what is the normal value. Until unless you know what is the normal value, you just can't get what is abnormal. Apart from it, you have a time serial quantification, means only just measuring blood pressure is not good, not enough. You have to understand how this particular either heart rate, blood pressure varies with time, which is known as variability. Apart from it, you have to detect relationship amongst these two things, right? Like how heart rate affects your blood pressure or how your sympathetic nervous system affects the vasoconstriction. So this kind of thing is going to establish a relationship. And lastly, to quantify the reactivity to the physiological stimulus. ये जो सारी चीजें हैं, ये सब हमारी body में हो रही हैं. And this is something, a challenge we give to the body and to see its response. So basically what are the quantifiable features? It is voltage, right? It is diameter of artery, velocity of flow, volume of flow and pressure, which is basically measured by this signal. Electrocardiography, ultrasound, Doppler, impedance plethysmography, and it is the photoplethysmography which is coming up, technique which is very much useful for assessing vascular functions. So coming to vascular function, we are generally having two functions, wall functions and endothelial functions. We are doing this both function on a regular basis for patient care as well as research. This wall function is basically associated with arterial stiffness and compliance, in which there is a change in pulse wave velocity and augmentation index. Apart from it, in reactivity, we do flow-mediated vasodilatation. This reactivity vasculature is very much altered in our sickle cell anemia patients, and arterial stiffness is altered in our kidney patients. So these are the derived parameters which are generally used using this following techniques to understand vascular functions. So just take an example of photoplethysmography. It is completely a non-invasive technique which only measures the changes in the blood volume with each beat. So this is an amplifier in its setup, which is a very simple setup, and it gives us this kind of graphs, right, or readings. This is ECG and this is your pulse waveform. by combining ECG with pulse waveform, we get many parameters like PP interval, amplitude, slope, clutch time, decay time. This parameters is actually a window for your vascular functions. As a physiologist, any physiologist who is working in the field of clinical physiology is very much interested in what happening to these parameters, right? Because it directly give us an, you can say, window about the health and disease conditions. So theoretically, the shape of waveform should be dependent upon the vasculature, diameter and tone of vessels and mechanics of heart, that is stroke volume and ejection period. So this is just an example. If you take a cold pressure test, this you are going to do, you have to just dip your hand in a cold water. What will happen? There is an increased sympathetic outflow, peripheral vasoconstriction and blood pressure increases. If this is not happening, there is definitely loss of this fiber system. And this is a diagram. This is just a representation of our lab data. Here it is a patient of diabetic patients. If you see, this is what is happening to the diabetic patient. Its reactivity decreased and in a normal individual. So there is a clear-cut demarcation. Now this data line has been published in Annals of Neurosciences, and this is something very important. So on the basis of this, we can say that this is a patient which is having diabetic neuropathy. Apart from it, we have response to vascular reactive hyperemia. We have to give ischemia and we have to see vasodilatation. If it is the direct window of nitric oxide synthesis in your body, right? What is the normal level of nitric oxide? You have this varies with time to time. But whenever there is an ischemic response and healthy body produces vasodilatation, which is lost in a case of sickle cell anemia, right? And this can be easily measured. So, all from it, we have to understand that assessment of vasodilatation during reactive hyperemia is a known clinical practice which is being used by physiologists to assess vascular functions. So, it can be correlated with amplitude, slope, apart temporal profile, and we can find out the changes. This is another very good response for stiffer arteries in patients of chronic CKD. This is the this is arterial, this is the walls which are getting thicker, and in CKD patient, that is chronic kidney disease patients, your arteries become a thread-like. So dampening of blood pressure with flow, like capillaries, it is almost negligible. If you can see just a turbulence kinds, it is dampened in capillaries, but when you have a thicker arterioles, it will carry up. Higher systolic pressure, higher pulse pressure, increase in pulse wave velocity, loss of dampening of pressure waves. This is a characteristic feature of CKD patients, right? And stiffer arteries have higher pulse wave velocity, leading to augmentation of pressure aorta. This is the work which is being right now going on in our department along with the Department of Nephrology, and we are assessing actually what is happening. So if there is an increase afterload and decreased perfusion, there is a left ventricular hypertrophy, can lead to congestive cardiac failure, and finally ischemia. So this technique is very simple. This is again, you have to take two sensors and you have to measure carotid and femoral artery, right? And these are the few parameters you have to understand. And these parameters are marked with your ECG. So this should be the ideal carotid waveform and this should be ideal femoral wave. If this is disturbed, definitely there is derangement. So functional consequences of stiffer arteries: increased pulse wave, increased augmentation, increased systolic blood pressure, pulse pressure, decreased baroreflex sensitivity, decreased heart rate variability, increased blood pressure variability. Right now the things which we are focusing is blood pressure variability. Apart from it, like we have assessed the peripheral circulation. This is some recordings of my own by using cerebral transcranial Doppler, right? And we have measured the cerebrovascular reactivity. How we have measured? We have given a rebreathing of carbon dioxide. Like we have just given a bag, person has to rebreathe into it, right? Apart from it, different carbon dioxide concentration is being given to the subject and by process of breath holding. We have also given the acetazolamide. So what is transcranial Doppler? It is again a non-invasive and ultrasound-based diagnostic imaging technique and which measures the blood flow of brain blood vessels, right? So this is a technique, this is a circle of Willis. We generally focus on the middle cerebral arteries and its branches, right? Because it has 3 windows and all 3 windows are for different things. It is transorbital, we have foramen window, and we generally focus from here to middle cerebral artery. So if you see, transtemporal window is transorbital for focusing anterior cerebral artery. Then transforaminal window, which is suboccipital, right? So I'll just show you how we measure it, right? In this probe, we can measure middle cerebral artery and all its branches, right? By moving our probes. This is the way we can measure your basilar artery and posterior cerebral artery. So we can actually know what are the changes in the blood flow. Right, and how the vessel is being identified, how I am very sure that I am using that window only. It is basically what window you are using and what is the transducer position. Apart from it, in which depth you are focusing your TCD. Flow of direction, if it is towards, you can say probe, it is flowing away, and it is going away from flow, it is going towards the center. So spatial relationship and mean velocity. This is the thing which we have standardized at AIIMS Delhi, that what is the velocity of a middle cerebral artery. This is the data of approximately 255 normal individual with an age range from 18 to 30 years. Okay, it is a young individual, basically our MBBS student we have used, right? And this is like middle cerebral artery. It is the transtemporal window which is being focused at the depth of 30 to 60 millimeter, and this will be the velocity. If this velocity is decreased or increased, we used to say that there is a problem, and this is applied for a case of orthostatic hypotension or any kind of cerebral problems. So in the same way, we have anterior cerebral artery, posterior cerebral artery, ophthalmic artery, vertebral artery and basilar artery. So this kind of spectral display we are going to get it, right? And this is the way where we get a systolic peak velocity, and diastolic velocity and mean velocity. So if, just an example, we have given an inhalation of 6% of carbon dioxide for 2 minutes, right? Now we see what happens. If you see, this is the baseline, okay? And we have just asked a person to hold a breath for 1 minute. Can you appreciate the changes in the flow velocity? From 58.41 centimeter in middle cerebral artery, it has changed to 74.25. Okay, and your brain should respond with this amount. Otherwise, you are going to have problem. Apart from it, if you see, this is that we are rebreathing in a carbon dioxide, right? 4%, 6%, and gradually there is increase in the cerebrovascular reactivity. This reactivity is very much happen whenever there is autonomic neuropathy or any case of vasculopathy. So in this form, we used to calculate conduction, and with conductance, we will know actually is there is any kind of vasculopathy in your brain. So with this, thank you very much, and I want to just conclude that vascular assessment is now the future for clinical physiology, and we have to actually focus on all these 3 techniques to assess peripheral as well as central blood flows. Thank you very much.